Good morning, students. So, in last class, we have discussed about the mechanism of urine, and also we have discussed the regulating of kidneys, regulating of kidney functions. So, mechanism of urine is taken place in a Henle's loop, where it is in a U-shaped tube, where it consists of descending as well as ascending limb. Yeah, descending limb is permeable of the water and impermeable of solutes, and as well as the ascending limb is impermeable of the water and permeable of solutes, where that is taken place the permeability of the permeability of the solutes. And second one, the maintaining osmolality. Here osmolality is increases from 300 to 1200 osmolality per mole per osmolality mole per liter. It is increases where it helpful for the that means the urine will becomes an hypotonic in conditions. Later here we will having in the either in ascending or descending limbs. Here the solutes are exchanging, and also the 5% the water is reabsorbed in the form of an ADH hormone. And also here in the interstitium of vas rectus, here what happens, the exchanging, that means the ascending as well as descending limb, that means urea and salts which are diffuses from the ascending limb of the solute, ascending limb diffuses into the vas recta of a descending limb, where they are excreted, where they are generally removed from the an interstitium, where the urine will becomes more concentrated, and that is here with the help of an ADH hormone, here more amount of water reabsorption along with urea and salts also. Here secretion is taken place when the urine will becomes water is reabsorbed. Here the urine will becomes more concentrated. It will becomes that concentrated urine is eliminated through the renal pelvis, from renal pelvis to the ureter, or ureter, from ureter to the urinary bladder, from urinary bladder they are excreted outside through the body. So that is discussed in the last class. And also the regulating of kidney functions. One is the RAS, that is RAS means renin, angiotensinogen and aldosterone system, and also that are secreted by juncta medullary and nephrons. And also here it increase the blood pressure as well as the blood volume, it is increasing, where that is second one is atrial natriuretic factor. That atrial natriuretic factor is helpful for, here it is opposite to the AAS, that means here increased blood pressure and volume, here it helpful for decreasing the blood pressure and the volume. And also another hormone is there, that is a diabetes, that is we can call as ADH hormone, that is anti-diuretic hormone, which maintains the disease called as diabetes and insipidus. I means here due to a polydipsia condition, that means taking off more water into the body, here the urine will becomes the tasteless. So this condition we can call as a polydipsia, or we can call that as polydipsia will leads to the a diabetes insipidus. Insipidus means tasteless. The urine will become tasteless, where here this condition is due to, why means here reabsorption of water is not be taken place due to the not reabsorption of water into the tubules. Here water is eliminated outside, where in the form of urine that are excreted. So these are the where we have discussed in the last class. Next, the other organs, the role of other organs in their excretions. So here role of other organs, in excretion. So here what is this role of other organs? So here other organs are mainly that are presenting, except kidneys, there are other organs such as skin, skin, second one is lungs, and also the third one is the liver. So these are the three organs where they excrete some other products which are acts as an excretory products. So these are excreted by these organs. So what are, how they are excreted? Now we will discuss the one by one. If you see in the skin, so here it is the largest sense organ present in our body. It is the largest sense organs present in the body, where the skin is acts as, the skin is an excretory organ where it consists of two type of glands. It consists of two glands are presenting, that two glands are, one we can call as sweat glands. The glands are called as the sweat glands, and the other one is called as the sebaceous glands. Sweat glands and the sebaceous glands. So here this the skin will produce the two glands. The two glands are, one is the sweat gland and another one is the sebaceous gland. So the sweat gland and sebaceous glands are mainly secretes. The sweat gland will secrete the sweat. The gland which secretes, the gland which secretes sweat are called as the sweat glands, where these sweat glands, it is a type of an excreta. That means here in the sweat, here it consists of a 99% of, here 99.5% of the water and also the sodium chloride. Along with this sodium chloride, here it can be able to excrete some amino acids, vitamins, glucose, amino acids, all these are excreted. Lactic acid and along with water and NaCl, it secretes the fatty acids as well as the lactic acids, and also some vitamins. These are excreted in the form of waste materials. That means here excess amount of sodium chloride which is presenting, that is excreted outside through the body in the form of sweat. Due to the producing of the sweat, here what happens, here they produce the sweat. It is due to this cooling, that means due to the sweat producing, it gives the cooling effect for the body, cooling effect for the body. That means here what is the sweat? If the temperature is increases and outside temperature is increased, then the body temperature, here the sweat is produced for what means here to cool the body temperature. To cool the body temperature, here they produce the sweat. Also here the sweat is helpful for the cooling effect for the body also, and it helpful for decreasing the temperature. That means it increases and increase the temperature, it helpful for decreasing of the temperature present in our body. That will give a cooling effect for the body, that is due to the mainly presence of the sweat glands. Next, the sebaceous glands. So what are the sebaceous glands? Means the glands which secrete sebum. The gland which secretes the sebum, sebum, and also oil glands, oily glands. So the glands which secretes oily as well as the sebum, that is a waxy coated substances which is secreted. Here sebum means it is a waxy coated material. That waxy coated material which is secreted, so that we can call as the sebum. Where the sebum is mainly is a waste material that are excreted outside from the body. Along with this oily gland they produce, that means oil will say presenting on the surface of the skin, where here they eliminate the excess of the oily nature which is presenting that will excreted and outside from the body. So this is a two glands, that means these are the skin is the and most of the an important sense organ, and it is the largest sense organ present in our body, where it secretes the two glands, such as one is called as sweat glands and second one is called as the sebaceous glands. And not only that one, here it helpful for the secreting of the, that means along with this sebum, it also secretes or eliminates lipids like wax, steroids, fatty acids and hydrocarbons. It secretes along with this, here they secretes the waxy, that is the fatty acids, hydrocarbons are eliminated from the body. Hydrocarbons, that means along the waxy or oily, and also the fatty acids and hydrocarbons are eliminated from the body of an organisms. Next, that is where we can take place as the skin, which acts as that is an excretory organ, and the second one is the lungs. Here the lungs also plays an important role in the excretion. Why means here the lungs are mainly helpful for respiratory organs, where here these part, that means the lungs which are presenting the excreted or the eliminated the carbon dioxide present in the body. Carbon dioxide present in our body. Why means the carbon dioxide is also a toxic substances present in our body. If it is presenting here, it affects the body. So here, due to this carbon dioxide is eliminated, that carbon dioxide is eliminated through the lungs. Here through the expiration process, through the expiration, here the carbon dioxide is sent outside of the body, where here it also eliminate or excrete the waste materials in the form of the carbon dioxide present in our body. So here it is that means lungs also plays a very an important role in the excretion. Next, coming to the second one, that is the third one is the liver. Now coming to the third one, that is a liver. So here a liver is the largest gland. It is the largest gland present in the body. It is the largest gland, where here the liver will perform many functions. It performs many functions. So here already we know that liver will perform many functions. So it is called as the metabolical factory. That means here, due to the performing of several activities, that means here the liver will perform several metabolical and activities are taken place. So due to the producing of several functions, here the liver is called as the metabolical factory. So here all metabolical activities are under the control of the liver. So here when the body is damaged, first the liver is damaging. Why means here it detoxifies the toxic substance which are enters firstly into the liver. Then the liver will convert the toxic substances into a non-toxic substance. That is, they are detoxified in the liver, where they are excreted outside from our body in the form of bile pigments or bilirubin or biliverdin. and also here these are convert this fat soluble into a water soluble substances where they are converted into this, and also it helpful for the filtration of the blade also. So these are the various functions. That means if the toxic substances are enters, that will be detoxified by the liver. So here liver will performs many functions. Due to this, here liver is called as the metabolical factory. So here first function it is taken place, how it is acts as an excretion. It secretes and excretion of bile secretions. Here the secretes and excrete. The secretes and excretes excrete bile pigments. So here when the RBC, that means when one RBC, that is hemoglobin, when hemoglobin in the blood, in red blood cells, in red blood cells, what is the hemoglobin is presenting? When this hemoglobin is presenting, it is worn outside. That means when the lifespan is completed, worn out. Here these will be the hemoglobin is dissociates into the bilirubin and biliverdin. So these are the two pigments where they are secreted, and these are mainly secreted in the bile juice. That means in the liver they secretes in the form of bile juice, where these are helpful for the secretion, very helpful for digestion of the food materials through the intestine, through the anus. These are eliminated and they digested, and excess of bile juice which is presenting that are excreted outside from the body in the form of bilirubin and biliverdin. And also when the worn out, that means when dead cells are, that means the dead cells of red blood cells are dead, the hemoglobin is divides into heme plus globin, where here this hemoglobin will be deaminated into bilirubin and biliverdins, where they are excreted outside through the anus. They are eliminated outside from the body of an organism. Along with this, the cholesterol, the fatty acids and the steroids, vitamins are also excreted and outside from the body. Here along with this, a cholesterol, steroids, vitamins and other substances, are excreted outside from the body of an organism, where they secretes always as excretes the waste materials excess amount in the form of bilirubin, and bilirubin they are excreted outside from our body. And the second one, if we see in the second one, it is in the form of an ornithine cycle ornithine cycle, or otherwise you can call that as urea cycle also, urea cycle, where here ornithine cycle, that means the ammonia is converted. That means by the deamination of ammonia, the deamination of ammonia, it is converted into an urea. So that urea is excreted outside. Why? Means ammonia is a highly toxic. By removing of one amino acids from ammonia, where it is converted into an urea. So urea is also a toxic substances where they are excreted outside from the body in the form of an ornithine cycle, or otherwise you can call as the urea cycle, where it was introduced by Krebs and Hanslet. the scientists where these are the two scientists where they have discovered the ornithine cycle, that means from the where here from deamination of ammonia urea is excreted, where here the end products are in the form of ornithine. So that ornithine is produced. So due to this cycle we can call as an ornithine cycle, where here the deamination process by removing of one amino acid from the ammonia, where they are converted into urea. This urea is a toxic substances. It is a toxic substances which are eliminated from our body. And also here it is also a third one. If you see in the third one, here it helpful for the purification of filtration of a blood. Here filtration of blood containing a toxic substances are presenting. That toxic substances, the toxic substances are converted into a detoxified substance, detoxified substance. The toxic substances are converted into a detoxified substances, where it helpful for the filtration of the blood. If blood containing any toxic substances are presenting, where here toxic substance means here chemical substances, or otherwise it may contain the bacteria or viral substances, where they fight against the kills. The kills and helpful for the killing of the harmful germs by the antigen and antibody complexes. Due to the antigen and antibody complexes, they fight against the harmful germs and they kill them, and they filtered the blood, where the excess amount of the toxic substances which are presenting, they are detoxified and they are excreted outside from the body. And also the enzymatic actions. Here enzymatic action means here it may also taken place the enzymatic action, where here where it is converted the fat soluble substances. The fat soluble substances are converted into a water soluble substances. Water soluble substances, where they are excreted outside from the body of an organism, where that is by the acting upon the enzyme, the fat soluble substances are converted into a water soluble substances, where it acts as the enzymatic actions. So which is excess amount which is presenting, that is fat soluble substances which are presenting, they are excess which are presenting, they are eliminated through the body, they are excreted in the form of urine. They are excreted in the form of urine. These are excreted in the form of urine. These are excreted outside from the body. So such type of organs, where they act as the excretory and organs along with the kidneys. So there are three major organs. One is the skin, second one is the lungs, and third one is a liver, where the liver will perform many functions. So you can call it as metabolical factory, and it is the largest gland present in our body, where here they toxified in the form of there secretes and excretes in the form of bile pigments, and also the ornithine cycle or urea cycle, and also the filtration of blood and enzymatic action, where here they convert the fat soluble is converted into a water soluble substance, where they are excreted outside in the form of urine. So these are the three excretory organs which are present in our body along with the kidneys. Now coming to the last one, that is the disorders of the excretory system, that will be discussed now. Now coming to the disorders of the excretory system. So here the first one is uremia. Uremia means the amount of the blood, that means the amount of deposition of the urea in the blood, that means the presence of urea in the blood, presence of urea in a bled. So this condition we can call as an uremia condition. What is uremia means? The presence of urea in the bled. Then this condition we can call as an uremia condition, where here it contains, it should be, that means 15 to 40 grams of urea is presenting in 100 ml of the bled. So this condition we can call that as an uremia. That means a presence of urea in the bled is called as an uremia condition, where here it shows the symptoms. Here what are the symptoms will shows means here it shows the excessively dry conditions. There are excessive dry conditions and a persistent itching. An itching is taken place, and nausea, this vomiting like sensation, and also muscle twisting, and also convulsion, that means shaking of the body will be taken place, and also the finally will leads to the coma. So these are the various the symptoms, where our symptoms will shows when uremia conditions, when uremia conditions are taken place in our body. That is the presence of the urea in the blood. If it is increased the amount, here it causing an uremia condition is taken place. But it is extending from 15 to 40, it will not lead, it is increases in the blood. It is 100 ml of blood, it is increased, gradually increase. Here it leads to the uremia conditions, where here it shows these are the symptoms, where they are showing excessive dry, persistent skin, itching skin, nausea, muscle twisting, convulsions, finally will lead to the coma. And coming to the second one, that is renal failures. Here renal failure means here the functioning of the kidneys is losing. So here the functioning of kidneys, the functioning of kidneys are lost gradually, losing gradually. So here where gradually, here for losing of the functions of the kidneys we can call as a kidney failure. So here there are two type of kidney failures are there. One is called as acute renal failure, and second one is a chronic renal failure. Here acute renal failure means here it is a sudden loss of the functioning of kidneys. Here sudden loss of the functioning of kidneys, sudden loss of functioning of kidneys, where here it is a temporary method. So here temporary it is presenting, by the treatment it can able to regain the functioning of the kidneys, where it is a reversible. Reversible means again the functioning of kidneys can be taken place. But in a chronic renal failure, here it is gradually the losing of the functions of the that is kidneys. Here gradual losing, gradual loss of functioning of kidneys. The functioning of kidneys, then it is called as the chronic renal failure. So here gradually leads means here it is a permanent method and it is reversible. Again it cannot able to cure this type of methods. But when the chronic renal failure will shows, here it shows the symptoms that are takes place in diabetics and also high blood pressure, or otherwise it shows an arteriosclerosis. Arteriosclerosis means here deposition of the calcium ions in the walls of the blood vessels. So this condition we can call as arteriosclerosis. And also the long-term chemicals, if you stay taking off long-term chemicals or tablets we are taken place, as well as if you taken place drugs like heroin, here it leads to the chronic clonic renal failure, that is a temporary, it is a permanent where it is a curation will not be taken place, so that here it is called as irreversible. That means when it is if you take medicines also, it is not able to cure, where here gradually leads to the losing capacity of the failuring of the kidneys, then this condition we can call as the clonic renal failures. So here symptoms, what are the symptoms will show here means here a frequent thirst and also an urination is taken place. That means when you take a more amount of water, here urination also more amount will be taken place. And also the swelling of the face and limbs. On the face and limbs, the swelling, that means increases the size of the face and limbs, as well as fizziness around the eyes. Eyes means the eyes will becomes enlarged. Fizziness, so that will taken place, and also unpleasant taste in the mouth, while that is unpleasant taste in the mouth, and also urine like odor in the breathing. When you breathing, a urine like breathing will be taken, that means urine smell of breathing, it is taken place during these conditions. And also due to the uremia also it leads to the causing of renal failure, and also excessive dryness, and also the skin is itchy skin, leathery, as well as the nausea conditions. So these are the various symptoms where it shows in the renal failures, that is either acute or it is a chronic renal failures. Next, coming to the third one, that is renal calculi. Here what is renal calculi? It means the formation of stones. The formation of the stones in the kidneys. So here in the kidneys, here the stone formations are taken place. So we can call that as a renal calculi. Calculi means stones. Here the stone formations are taken place in the kidneys, where here it helpful for obstructing of urination. Here symptoms will show the urination is a painful urination is taken place. Urination is urination is a painful urination. A painful and urination is taken place, and also here the formation of the stones, this condition we can call as urolithosis. That means the formation of urine, that formation of the stones, that is called as urolithosis. And if that stones are crushed, when it is crushed, here it helpful for that means the stones are broken down. When the stones are broken down through the urine, these stones will be eliminated outside from the body in the process of an urolithosis, that is formation of stones, that is by the method. And also here it shows the gout also. Here due to the gout, G-O-U-T, gout, here it shows due to the gout. Gout means inflammation of joints, where here accumulation of, that means inflammation of joint due to accumulation of an uric acid in the stone in the joints. This condition we can call as a gout. So what is the gout means? Here inflammation of joints due to the uric acid deposition, that means accumulation of uric acid in the joints. So this condition we can call as a gout also. It is also a type of a disorder where it shows a kidney, that means disorders of a kidneys, where in the joints here accumulation of uric acid is taken place. And also here symptoms means here main two symptoms will show when kidney stones are formed. That is, one is an urination, that is a painful urination, and also the back pain, back of the body, a pain is produces a pain will be produced at the back of the body as well as in the chest region. Here a pain is back of the chest. Here a painful pain is produced. So these are the two symptoms where it shows that kidney stones are formed in the kidneys. That means stones formations are taken place in the kidneys. One shows that urination is a painful urination. When you are urinated, you are a painful. Why means when due to the obstructing, that means stones are formed. Here obstruct the full flow of urination. So here a painful and urination is taken place, and also at the back of the body a pain is produced. These are the two symptoms where it shows in the renal calculi, that is formation of stones in the kidneys. So caliculi means stones. So here the formation of stones is called as an urolithosis. So these are the three symptoms. Along with this, here it consists of another one is nephritis. Nephritis means the inflammation of nephrons. Here we can call as the nephritis. And also last one, that is it shows that is we can call as an artificial kidneys, that is called as dialysis. So what are that? Now will be discussed. Now coming to the fourth one, that is nephritis. Nephritis means the inflammation of nephrons. Inflammation of nephrons is called as the nephritis. Inflammation means becoming a redness. The nephrons are which becomes into the redness. This condition we can call as an inflammation of the nephrons are called as nephritis, where here it shows the symptoms, the swelling tissue in the face, around the eyes and the legs. That means swelling part of the face as well as around the eyes and legs. Reduction in the urine volume. Here reduction of urine volume is reduced, and also increase the blood pressure. It increases the blood pressure. In advanced condition, it's here, and that means when the nephritis is in advanced condition, here it shows the loss of appetite, the vomiting, as well as abdominal pains and joint pains are taken place, where here it shows in an inflammation of nephrons when it is in advanced. That means loss of appetite means the loss of body is taken place, that is called as an appetite, and vomiting, abdominal pains as well as joints pains are taken place. Next, coming to the last one, that is the dialysis, that is called as dialysis or artificial kidneys. So here what is dialysis means the separation of the solutes from the solution through the dialyzer. That means here separation of solutes from the solution in the form of a dialyzer. So this process is called as through the semi-permeable membrane. So here what is dialysis means the separation of solutes, the separation of the solutes from a solution through the semi-permeable membrane, through a semi-permeable membrane. So this process we can call as dialysis or artificial kidney. That means separating of solutes from the solution through the semi-permeable membrane from the process in the form of a dialyzer. We can use the word as a dialyzer we are using. So this process we can call as a dialysis, or we can call as an artificial kidney. So here it takes place two methods. One is called as a hemodialysis, and second one is called as the continuous obligatory peritoneal dialysis. Here hemodialysis means, here hemo means blood. That means here blood is separating from the body, where through the solution these are passes, where through the semi-permeable membrane these are passing. Here the excretory products which are presenting, that is in the form of urea, uric acid, creatinine, and hippuric acid which are presenting, they are eliminated from the body. So that is taken place. So such process we can call as a hemodialysis. In the hemodialysis, here it takes place with the help of a catheter. With the help of a catheters we are taken place, where here two catheters are taken place. One is connected to the artery of the wrist and another one is connected to the veins of the wrist. One is connected to the artery, where in the wrist condition these are connected. One is connected to the artery and another is connected to the veins. So when it is passing here, what happens means the blood is cooled at 0 degree centigrade. When blood is passing, when blood passes through artery, here what happens, the blood is cooled at 0 degree centigrade. It is cooled at 0 degree centigrade where it is passing, and here using an anticoagulant substance. We are using an anticoagulant substance. That anticoagulant substance is called as the heparin. It is called as the heparin. The anticoagulant a substance that is called as heparin, where it is passes through the catheter, through the solution these are passing. When these are passing through the dialyzer, here they separates the solutions. So here a dialysing fluid will consist of these are isotonic, where it consists of sodium, potassium, calcium, magnesium ions. Along with this will consist of glucose. Glucose also will be present in, and also the pH of body temperature is also will be maintained, where it helpful for the separation of the toxic substances like hippuric acid, as well as creatinine, as well as uric acid. These are excreted outside. When these are excreted outside through the dialysing fluid in the form of through the semi-permeable membrane. Here dialyzer solution will act as the permeable membrane, where it acts as then blood will act as the permeable plasma membrane will act as the permeable membrane, where it is passing of that means larger molecules will not be passed, that is blood and blood cells, blood and proteins are not be taken place, where they are excreted. Harmful substances are excreted outside through the process of semi-permeable membrane. Through the diffusion process they are excreted outside. When they are excreted outside, again that blood is passed through the another, that is through the vein, that is blood is passed into the body. So when it is passing into the vein, again here the body temperature will be, that means when it is enter into the body, here due to the body temperature that it becomes very warm in nature. It becomes into the warm in nature, so that what happens here that will be taken place again when enter into the arteries, when enter into the vein. Here we are giving anti-heparin we are giving. We are giving an anti-heparin we are giving, where it is enters into the arteries, where here the elimination of the waste materials are taken place through the dialyzer, that is through the dialysing solution. They are separating the toxic substances are separated from our body. And here it should be taken place, that is hemodialysis. The hemodialysis should be taken place twice in a week. Hemodialysis, it should be taken place twice in a week. Twice in a week, that means in a week here 2 times it is should be taken place. So here compulsory the patient should be goes to the hospital. Compulsory the patient should have to goes to the hospital for every week. Here 2 times the patient should goes to the hospital, where through the dialysing solution here the separation of the waste material, that is harmful substances are excreted and outside from the a body, that is in the form of a hemodialysis. And these two are very highly costly in nature. That means when kidney failure, that means both kidneys are failed to function, the excreting of waste materials. This process, dialysis, is very costly in nature. And second one, a continuous obligatory peritoneal dialysis. Here peritoneal, that means continuous means regularly. Obligatory means moving about. Obligatory means moving about. That means when you moving about, that means wherever you go, wherever we go, here this process will be continuously, will goes on the separating of the waste materials from the body, so that it is called as a continuous obligatory, continuous moving about through the peritoneal dialysis. That means through the peritoneum. This peritoneum layer, the peritoneal layer will act as the semi-permeable membrane. It acts as a semi-permeable membrane. Through the peritoneal membrane, here separation of the waste materials are taken place. So through the diffusion process, here it is taken place. So here this process is called as the continuous obligatory peritoneal dialysis, where here also here using here what happens means in this method, here a small cut is taken place in the abdominal cavity, where here this catheter is fixed. That means the catheter is fixed in abdominal cavity. In the form of dialysing a solution. In the form of a dialysing solution, it is fixed in the abdominal, where in the abdomen a small slit through a small cut that is passes to the abdominal cavity. It is fixed, where in the form of catheter it fixed, where through the peritoneal layer will act as a semi-permeable membrane. So when it is taken place, here what happens? So through this, that means in the dialysis fluid will consist of the sodium, potassium, magnesium ions, and also here will consist of glucose also will be presenting, where it maintains the constant pH level of the dialysing fluid, that is the blood. And when these are separated, that means here harmful substances which are presenting, they are separated to the peritoneal layer through the semi-permeable membrane by the process of a diffusion process. So when it is taken place, here it helpful for the separating of fluid, but here it is a continuous process. That means here once they are fixed in the abdomen cavity, here we can go wherever you want to, you can go. So you can call as obligatory. Obligatory means moving about. Wherever you go, this process continuously will be taken place, like kidneys, how the kidneys function is taken place, that will be separated. So here a bag is attached to the abdominal cavity. When its bag is filled, it should be eliminated outside from the body. So this is the process how it is taken place. When it is here, when abdominal, that is continuous obligatory, it is taken place, here it causing a disease called as a peritonitis. What is the peritonitis? Means the inflammation of peritoneum layer, inflammation of a peritoneal layer. So this inflammation is called as a peritonitis, where it is causing a disease, where here a bacterial an infection will be taken place in the body, where here why means here continuously here the excreting of waste material. So due to this bag here pouching, here infections, bacterial infections may be taken place, where it causes a disease called as a peritoneal diseases, that is peritonitis. So here continuous in is obligatory, it is a costly methods, where here the patient have to carry the bag continuously. Why means here the bag is attached in the abdominal, where here excreting of waste material through the dialysing solutions. So these are the two methods where artificially will be taken place, where the separation of the toxic substances from the body, that is if both kidney functions are failed. When this is taken place means when both the kidneys are functions is taken place is failed. So here this condition we can call as a dialysis through the separation of solutes from the solution through the semi-permeable membranes. Through semi-permeable membrane we are separating this fluid from outside, which is excretory waste materials from our body. So this process we can call as a dialysis, or otherwise you can call them as an artificial kidneys. So there are two type of artificial kidney process. One is called as hemodialysis, where here it is taken place twice in a week. That means in a week 2 times it should be taken place. In the hemodialysis, here compulsory the patient should have to go to the hospital regularly. That means in a week for 2 days every patient should have to go to the hospital. But in a continuous obligatory peritoneal dialysis, the patient may not go for continuously the hospital. Why means here they are attached the bag in the form of dialyzer fluid, where that is helpful for it can wherever it goes, wherever the patient goes, here this process will be continuously will be taken place, the separation of toxic substances through the a peritoneal layer. This peritoneal layer will act as a semi-permeable membrane. So this is the two process where it is taken place, that is artificial kidneys. So this is the topic of an excretion. So in the next class we will discuss that is about the nervous system. We will discuss the new topic, that is a nervous system. So these are the various disorders. One is uremia, second one is renal failure, and third one is renal kidney failures, that is second one. Third one is renal calculitis, fourth one is nephritis, and last one is dialysis, or otherwise we can call that as an artificial kidneys. So this is the topic of an excretory system. So in a next class we will discuss that is a new topic, that is a nervous system. Okay, thank you.